Hello, I'm Kishore Visvanathan. I'm a urologist in Saskatoon, and I'm also chair of Saskatchewan's Prostate Assessment Pathway. The Prostate Assessment Pathway is one of several pathways created through Saskatchewan's surgical initiative. The purpose of the pathway is to help provide Saskatchewan patients with more consistent and timely access to evidence-based care. The particular purpose of the Prostate Assessment Pathway is to help you get more rapid assessment of men in your practice whom you may suspect of having prostate cancer. In most cases, the suspicion of prostate cancer will come up with your patient either through an elevated PSA or prostate-specific antigen blood test or through an abnormal DRE or digital rectal examination. In some cases, you may have a suspicion that your patient has prostate cancer because they have metastatic disease of undetermined origin. For example, they may have bone pain or may have X-ray changes showing sclerotic bony metastases. In the case of suspected metastatic disease, then the prostate assessment pathway is not appropriate for your patient, and that man should be referred directly to a specialist, such as a urologist or an oncologist. If there's a suspicion of early prostate cancer, again because of an abnormal PSA or DRE, then the prostate assessment pathway may be appropriate for your patient. If your patient's PSA or prostate-specific antigen is abnormal, there are a few initial things to think about before referring to the pathway. First of all, it's important to know that there is variation in the PSA test over time. As such, your patient requires a repeat PSA about 6 or 8 weeks after the initial elevated PSA to be certain that it wasn't a false positive elevation. Also, if your patient had their PSA measured while they were having a urinary infection such as a cystitis or prostatitis, then it may be a false positive elevation, and they should have their PSA repeated about 6 to 8 weeks after antibiotic treatment is finished. This helps to avoid unnecessary investigation and testing based on false positive results. If the PSA remains elevated and is elevated according to age-specific guidelines, which are documented in the pathway, then your patient is a candidate to be referred to the assessment pathway. Also, if your patient has an abnormal digital rectal examination, or DRE, then he is a candidate to be referred through the prostate assessment pathway. If your man is found to have an abnormal PSA or DRE, the next step is to complete the referral form. On the referral form, you'll be asked to include information about your patient's past medical history, specifically pertaining to referral to the prostate assessment pathway. For example, if your patient has diabetes or is on anticoagulation medication, then special preparation may be necessary before your patient has a biopsy. If that's the case, we'll ask you for that information, and there are specific instructions on how to prepare your patient for prostate biopsy under those circumstances. Depending on whether your patient is referred to the Saskatoon or the Regina prostate assessment pathway, their experience may be slightly different. In Regina, the assessment will be done directly at the prostate center, and a radiologist will assess the patient, including all the information you've sent along, and counsel the patient as to whether or not a biopsy is appropriate. If your patient is referred to the Saskatoon pathway, we'll ask for some additional information to decide whether or not your patient may go directly to an expedited prostate biopsy in order to determine whether they have prostate cancer. In order to determine whether they are candidates for expedited biopsy, we'll ask you several questions. First of all, if your patient is younger than 40 years of age or older than 75 years of age, he's not a candidate to enter the prostate assessment pathway. The rationale for this is that men under the age of 40 are more likely to have a false positive PSA, accounting for an elevated PSA, than actually having prostate cancer. For this reason, we want to avoid unnecessary biopsy, and that man will be assessed by a urologist rather than going directly for biopsy. Also, if your patient is over 75 years of age, the chance of him having occult prostate cancer is very high, but he may not be a candidate for treatment even if a biopsy were positive. For this reason, men over the age of 75 will not be candidates for expedited biopsy and will be referred directly instead to a urologist. The second question we'll ask is whether or not the PSA is over 50. If the PSA value is over 50, then the chance that this man has prostate cancer is very high, and he may also have metastatic prostate cancer. In this situation, he may not benefit from a biopsy, and it may not be necessary to start treatment. If your patient has a PSA over 50, he will not go for expedited biopsy, but will be referred to a urologist instead. If your patient has an abnormal digital rectal examination, yet a normal PSA, he will also not be eligible for the prostate assessment pathway. This circumstance doesn't indicate that your patient does not have prostate cancer, and it doesn't indicate that he doesn't require a biopsy. However, we feel that digital rectal examination can be somewhat subjective, and in order to avoid unnecessary biopsy for men who don't require it, a urologist will assess the man, repeat the DRE, and determine whether or not a biopsy is appropriate. This is in the circumstance where the rectal examination is abnormal, but the PSA is normal. If your patient has had a previous prostate biopsy, he won't be accepted into the prostate assessment pathway and instead will be referred to a urologist for further assessment. The reason for this is that patients who've had a previous negative prostate biopsy may not require an additional biopsy depending on the change in their PSA level from the time they had the previous biopsy to the current time. This should be assessed by a urologist. Of course, if your patient has a previous diagnosis of prostate cancer, they don't require another prostate biopsy unless they are being followed by a urologist for active surveillance. In this case, the urologist will make the decision on whether or not a repeat biopsy is necessary. If your patient is immunocompromised, we will have the urologist assess them ahead of time because they'll be at higher risk for some of the potential complications resulting from prostate biopsy. If your patient's life expectancy is less than 10 years, he will not be a candidate for rapid assessment through the prostate assessment pathway. The rationale for this exclusion criterion is that men with less than 10 years life expectancy may not benefit from having a diagnosis of prostate cancer made. In this circumstance, we'll have the man assessed by a urologist, and a decision at that point can be made in consultation with the man whether or not he wishes to undergo prostate biopsy. After completing the prostate assessment referral form, you'll fax it to either Regina or Saskatoon, and the intake staff will assess whether or not your patient is a candidate for rapid access to the prostate assessment pathway. After that, the intake staff will contact your patient with the appropriate next step, and you will be informed of your patient's next step at every point in our contact with them. After our intake staff receive your referral form, your patient will be contacted to inform them of the next step in the process. You'll also be kept informed as to your patient's progress through the assessment process. The nurses in the prostate assessment pathway will contact your patient to inform them about the prostate biopsy procedure. The purpose of the prostate biopsy is to make the definitive diagnosis once you've identified a patient who has a suspicion of having prostate cancer because of either their elevated PSA blood test or the abnormal digital rectal examination. Those tests can only adjust the suspicion of prostate cancer but can't give a final answer. It's the prostate biopsy that gives the final tissue diagnosis. While the nurses will be giving your patient specific information about the prostate biopsy process, it will be very common for the man to ask you for some further information. The prostate biopsy is performed by a radiologist and is done very similar to a digital rectal examination. Rather than inserting a finger, however, the radiologist will insert a small probe called an ultrasound. Using the ultrasound examination, the radiologist can see the entire prostate, and that examination guides a small needle. It's the needle that takes the samples of the prostate, thus resulting in the biopsy. That biopsy takes about 15 or 20 minutes to perform. It's performed at the prostate center at the hospital, but your patient doesn't need to remain in the hospital. They will remain in the assessment center for some time afterwards to make sure their recovery is smooth, and then be discharged home. It's also common to have certain side effects afterwards, including blood in the urine or blood in the rectum for 24 to 48 hours. Also, blood in the semen is common for up to 4 or 6 weeks. These are common side effects and clear spontaneously. All men will receive a dose of prophylactic antibiotics before the biopsy. Even so, there is a risk of developing urinary infection after the biopsy. This would require further antibiotic treatment. There is also a small risk of developing sepsis, which would require hospitalization and intravenous antibiotic therapy. After the biopsy result is returned, the prostate assessment pathway will give you the option of either contacting your patient directly with the biopsy results or having the nurse at the prostate assessment center contact your patient on your behalf. Saskatchewan's prostate assessment pathway is designed to provide your patients with more rapid and appropriate access to diagnosis for a suspicion of early prostate cancer. The prostate assessment pathway provides an algorithm that you can use to decide whether your patient is a candidate for rapid assessment through the pathway and direct biopsy under your order, or whether your patient should be assessed further by a urologist. Other components of the pathway are counseling of your patient regarding the prostate biopsy process, the potential to have the prostate biopsy results communicated directly to your patient by the pathway nurse, and also the opportunity for your patient to receive counseling and education directly by a specialist nurse if their biopsy should show prostate cancer. At any point in the pathway, either you or your patient can request direct contact with the urologist, and this can form part of their prostate assessment pathway experience. Thank you for considering the prostate assessment pathway as a way to expedite care for your patient.